Three, two.
Good morning, everyone. Welcome once again to our weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgilla, Hispanic Public Information Officer, and joining us today is Dr. Keisha Davis, the county's health officer, Mr. Sean O'Donnell, Deputy Chief of Public Health Services, as well as Dr. James Bridgers, who is the Director of the Department of Health and Human Services. Our special guest today is the county's Fire Chief, Mr. Corey Smetley, as well as Maryland State Delegate Pam Queen. We also have a surprise. We have a team that just returned from Florida, I believe, from Montgomery County Fire and Rescue Services. Thank you, everybody, for joining us. Mr. County Executive, good morning to you.
Good morning, everyone, and thanks for joining us again this week. For the second time in 3 weeks now, people in Florida are dealing with a severe hurricane. As you know, Hurricane Milton is wreaking havoc in Florida, and it's now tailing off to the East Coast. Still has high winds in its wake and a lot of damage that's been done. We had sent an emergency crew to help with Helene, and now there's Milton. These crews will be relieved by other crews from Maryland so that work can continue. And I want to thank the 45-person crew that put in tough 2 weeks and is now returning home. You're going to see them later, I think. And they shared a picture on social media that I'd like to share with you. I want to mention the Maryland National Guard Helicopter Aquatic Rescue Team for recognition. Their rescues of people and pets cut off because of mudslides and washed out roads were some of the most dramatic images tied to the storm. Helene was a tragedy that took hundreds of lives, but it could have been more without the work of the rescue and search specialists we have. And disasters like these emphasize the need for blood. This summer, the American Red Cross put out an alert that the national blood supply had fallen 25%. Blood supplies were needed faster than donations were coming in. So I encourage everyone to help replenish the blood supply. One opportunity to do that is coming up on Saturday, the 20th. Montgomery County Fire and Rescue Service will hold a blood drive in memory of local firefighters Carlos Alfaro Sr. and Jr. It will be held from 8 a.m. to 2 p.m. at the Public Safety Training Academy on Snoffer School Road in Montgomery Village. And at this point, I'd like to welcome Fire Chief Corey Smedley to the media briefing to discuss how the department has responded to these natural disasters and how they're addressing this critical need for blood. So welcome, Chief Smedley.
Thank you, County Executive Elrich. And I'm proud to say that our Maryland Task Force 1, the first team, has just came back home about 10 o'clock this morning. They're on the call now. Just so you know, your Maryland Task Force 1 is the host agency is Montgomery County Fire and Rescue, but it's a coordination of several agencies, including the District of Columbia, Frederick County, Prince George's County, Anne Arundel County, as well as Howard County. So it's made up of all those jurisdictions that work, train, and save lives together. We have been in Florida, Georgia, and North Carolina. We also have a second team that is down in Georgia as we speak, and they're making their way to Florida to help in the ravage from Milton. We have done several things that I'm going to let Battalion Chief Fabrizio discuss because they've been on boots on the ground and they can better give you firsthand account of the great work that they've done.
Hello, Mr. Fabrizio. It's your turn.
Perfect. Good morning. Thank you for having us. My name is Chase Fabrizio, one of the task force leaders with Maryland Task Force 1. With me at the table, we have our Mission TFL, Josh Curlin. We have our K-9 specialist, John Hooker, who represents Washington, D.C. Fire Department. We have Nathan Wandamu, who is one of our rescue specialists. And then we have Bradley Walters, who's a member of MCRFRS as well, who is our rescue team manager. I'll let Josh Curlin get into the details of the mission set that the team completed. That encompassed travels and rescue work in the state of Georgia and the state of North Carolina.
Josh Curlin, Mission Task Force Leader. So we were activated by FEMA on September 25th, a couple days before the storm hit. They wanted us to report to Macon, Georgia, By the next day, by noon, we did that. And then we were awoken at 4 a.m. the next morning, right after the storm, with a report of a collapsed building in Valdosta, Georgia. We got there and we found that collapsed building. We utilized our canines to search the area. Fortunately, we did not find anybody that needed to be rescued in that building. It was vacant at the time. But we also found a couple days worth of work for search and rescue efforts. Valdosta is a city that is just very tree heavy, lots and lots and lots of trees within the city. And they were collapsed on buildings, houses all over the city. So we conducted 2 days of search and rescue efforts in Valdosta, laying down hundreds of miles of tracks so FEMA would understand what was searched and what still needed to be searched. We were then reassigned to the state of North Carolina, where they saw the most severe damage from Hurricane Helene. We operated in Haywood County, which is west of Asheville, for 2 days. And then we were reassigned to Buncombe County, just east of Asheville, where the worst damage was. And we operated there for 6 days, conducting search and rescue efforts.
Anyone else from the team is going to anything else, gentlemen?
No, I think we're good. We're obviously proud of the efforts that everybody put forward. It was a long 2 weeks. As Chief Smedley mentioned, we have representation from several other participating agencies. We also want to thank, obviously, the county executive, the fire chief, the CAO, the state of Maryland with the Department of Emergency Management for supporting us while we were all downrange serving the citizens of Georgia and North Carolina. So for everybody, for your support, thank you very much for that.
Thank you.
Thank you. Thank you.
Yeah. Last but not least, I want to thank our local International Association of Firefighters, Local 1664, because while these men and women were down in the southeastern region, people stepped up to cover Montgomery County. So we were never in any danger of not being able to take care of our county. So I wanted to make sure that is also known. That happens on a regular basis, and I just wanted to bring that to light for our local IFF. Thank you.
Okay, members of the media, we are going to open it up right now for questions regarding the rescue efforts for the team and or the chief. Please raise your hands. Any questions regarding this topic? No questions this morning regarding this? Well, Chief, thank you so much for joining us. The same for the team that joined us as well. You can stay on the call if you'd like to, and if you have to go, you're free to depart. Thank you for joining us.
Perfect. Thank you for your time.
Thank you.
I'd like to thank everybody just personally. I mean, it is amazing work you have to do. But it, as the chief said, it takes the whole department, because when we do this, we have to be sure that we don't find ourselves short-staffed and unable to respond back here. And so it took all of the firefighters to make it possible for you guys to get down to where you were and leave Montgomery County still adequately covered in your absence. So thank everybody else back when you get back to your departments. Be sure you convey to them our appreciation for everybody pulling together to make this possible.
Will do. And as always, thank you for your support as well.
Thank you.
Thank you. Thank you.
I always tell people I have the easy job on this. You know, we set a budget and we set the dollars, but the people like the folks we just talked to are the people who actually do the work, and they make it possible for us to get credit for what happens here. But it's really those folks every day who are out there on the lines who really do the things that people appreciate in the county. And this is just another example of that. I'm going to talk now about another event coming up. It's a breast cancer awareness event. It's Montgomery County's co-hosting. The Park Goes Pink for Breast Cancer at Wheaton Regional Park this Saturday, October 12th from 10 a.m. to 2 p.m. It's a free event, and it's aimed at helping highlight the importance of early detection and the need for regular screenings and education to address this life-threatening disease. Breast cancer is the second leading cause of cancer-related deaths for females in Maryland after lung cancer. And there are also significant racial disparities between Black women and white women for breast cancer mortality, with Black women diagnosed more often at later stage. Early detection is crucial in treating the disease effectively and saving lives. I want to thank Maryland delegate Pamela Queen and the African American Health Program for leading the way on this initiative. There are many people in our community, including Delegate Queen, who have firsthand knowledge of the breast cancer battle. She's a survivor, one of many people who will be there with encouragement lessons to share. I want to thank Delegate Queen for being available today, and thank you for joining me now to discuss how breast cancer impacts our community, as well as our county health officer, Dr. Keisha Davis, to talk about tips and resources that are available. So I'll turn it over to you, Delegate Queen.
Well, thank you much, County Exec. I first do want to say from the state, we want to thank our firefighters for what they have done for us and representing us well throughout the nation. So I want to say thanks to that. But I want to thank you for recognizing the importance of this event. We are coordinating and partnering with the county, Maryland Parks and Planning, African American Health Program with McFarland Associates for this first time event that we're having. And so this is important, as you mentioned, because the disparities for breast cancer, especially nationally and in Maryland, are very concerning for Black women, especially, as you mentioned, that are diagnosed with higher rates of breast cancer and often dying from breast cancer. As you mentioned, I'm one of the women who was diagnosed with an aggressive form of breast cancer in my 40s, inflammatory breast cancer, which is rare and very aggressive. Often enough, Black women have more aggressive types of breast cancer, and so their treatment is often very aggressive, having to have chemotherapy, mastectomies, as well as radiation treatment. And so this event is for us to better educate women and to empower them so they could be their best advocates when speaking with their doctors. And so we want them to know about some of the risk factors. We know breast cancer is more prevalent in women than in men. Typically, the age of breast cancer is older, in the 50s, but what we see for Black women, they are diagnosed at a much younger age. We talked about also the prevalence of high risk of the type of cancers that we see in Black women, but for all women, this is very important to make sure we have early screening, because early screening helps us to prevent the adverse effect or death from breast cancer. So what we will have at this event, we have over 20 vendors that are coming out, medical professionals from Holy Cross, MedStar, to talk about the risk factors, what information they can have, what's available in terms of resources that's available to women in the county and throughout the state. We'll hear from breast cancer survivors about their journey and experiences. But there's also things that people don't recognize when they are patients or family members. There's also resources for rise to treatment, help with house cleaning, help with prosthetics and wigs, support groups that help the whole family to cope with this issue, because it's a big impact to families. But we want to make sure that this is a festive event, so we will have activities, line dancing, a DJ, activities for children, photo booth. We'll also have food trucks there, so it'll be a great time for everyone to come out. As was mentioned, it'll be at Wheaton Regional Park. We're asking folks to park at the Kennedy High School and have a shuttle come over, because we'll have food trucks and mobile units to do screening. And so parking may be limited at the park. But we really want you to come out and make sure that you're learning more about this disease. We know that prevention saves lives. And so we really want to make sure that everyone is well educated, well informed, so that they can help to be their best advocates.
Thank you, Delegate
Thank
Queen.
you.
Thank you. Members of the media, any questions at this time regarding breast cancer awareness or the Park Ghost Bank event this Saturday, October 12th, starting at 10 a.m. at Wheaton Regional Park? Any questions regarding?
If I can just add a couple comments just about breast cancer. I just want to say we are really excited for this first event, hopefully first of many, first annual event, I'll say, and really want to thank Delegate Queen for sharing her story. And being an example of why it's so important to get early screening and detection, thanks to the African American Health Program for partnering and putting this together, Parks and Planning and the Rec Department and everybody that's involved in this event. October is Breast Cancer Awareness Month, and it really is a great time to raise awareness about the impact of breast cancer. The thing that folks may not be aware of is that Black women are actually less likely to have breast cancer. They have a lower incidence of breast cancer. And despite that, they are 40% more likely to die of breast cancer than white women. And this is because their cancers are often detected at a later stage when they are harder to treat. And so it just re-emphasizes the point that early detection really is key. We know that Latino and Asian populations also face unique challenges in access to care and early detection because of language and insurance barriers. So the great thing about this event is, while yes, it will have screening, it's going to have resources for not just getting the mammogram, but supports for folks once they have breast cancer, how to find a ride to treatment, how to get help with cleaning your home, how to get help with some of those other supports like massages or how to do your makeup. So we really encourage folks to come out. I also want to put out that public health reminder about getting a mammogram. It is the best tool we have to detect breast cancer when it's early. The U.S. Preventive Services Task Force recommends that all women 40 and over get screened every other year. If you have a history of breast cancer in your family, you should start earlier. There's also some high-risk populations who should start earlier, so have a conversation with your primary care doc if you're not sure when to start. But we want to make sure that folks get the message, get screened. It makes a difference. We know that in the past 4 years with COVID, we've seen a decrease in the number of folks getting those routine mammograms. And as a result, we are expecting to see cancers show up later and more advanced. So we want to remind folks, get that mammogram, remind your friends, your family, your loved ones to get that preventive screening.
Thank you, Dr. Davis. Members of the media, any questions regarding breast cancer awareness? Any questions? Raise your hands. No questions? Thank you, Delegate Queen, for joining us today. Again, if you'd like to remain on the call, you can stay on. If not, feel free to depart. Mr. County Executive.
Thank you, Delegate Queen, very much for being here today.
Thank you.
And I'll see you this weekend.
See you later. Bye-bye.
Okay, bye-bye. So on to other things that we're doing. So last week I addressed two proposals that are before the County Council: the Growth and Infrastructure Policy, or the GIP as it's called, and the Attainable Housing Strategies, or AHS. This week I want to discuss their connection to each other and why the Planning Board's recommendations would negatively shape the future of our county's budget and the services we provide. I want to be clear at this point that these comments are on the Planning Board's proposals on the AHS and the GIP. The Council has made some improvements in committee regarding the GIP, and it'll go to the full Council next week. The Adequate Public Facilities Ordinance, the APFO, was created in response years ago to public frustration with growth that came without the necessary infrastructure and the means to pay for it. The Growth and Infrastructure Policy was supposed to be the implementation tool for the Adequate Public Facilities Ordinance. This is a policy that's been in place for years with the goal of making sure that new development doesn't outpace the services and facilities that we need to support it. And the facilities were primarily supposed to be paid for out of the developer bucket, so to speak. That changed as developer contributions to campaigns grew and memories of the efforts it took to create the policy faded. The Planning Board and various councils began eroding the traffic and school standards, and most importantly, reduced the developer's share of costs for this infrastructure. When I came on the council in 2007, we actually had a council majority that strengthened the ordinance, but now the standards are worse. It was worsened over a period of years, and the payments we receive are less. Because subsequent councils did not insist on adequate public funding from developers and didn't want the political consequences of providing those services by raising taxes on residents, the county went down the worst possible path, reducing revenues. We've seen 5 reductions since 2013, weakening the definition of what is adequate. The easiest way to fix adequacy became to redefine the test so that nothing failed. We would literally have discussions, and when you'd realize that it couldn't pass the test, a project couldn't pass the test, the discussion became, well, how do we change our standards so these projects will pass the tests? I think one of the worst misuses of the argument against tests and the things that the county had put in place was people blamed the moratoriums for, this is the result of these, policies the county had. It's a result of the policies only because the council never did what it could have done to relieve the moratoriums. The moratoriums were only put in place when either school capacity wasn't adequate or traffic capacity wasn't adequate. And the solution was to either build traffic or transit projects or add to school capacity. And so areas stayed in moratorium because the past councils, refused to fund the schools and transportation. And so those areas lingered in moratorium. So the way that problem was solved in moratoriums is they got rid of the moratoriums by lowering the standards to the point that nothing fails. It's very hard to fail a traffic test. It's almost impossible. And the school test allows for payments, but the payments that we get aren't adequate to deal with the school capacity issues that additional growth has been causing. So there's a reason why we have this backlog, and compounding the backlog because of the lack of money we receive on the development side. We have a bond policy that has held bond spending pretty much unchanged for 7 years. And because inflation has grown over 7 years and pretty substantially, we actually have fewer dollars available today to address the needs. We still have the same 280 million, or 280, but 280 doesn't buy what it bought 7 years ago. So we're actually able to buy less and less with this level of steady funding. Because of inflation, we do have less. The planning board's GIP is another blow in the wrong direction. Less revenues and more exemptions from the standards. Now the attainable housing strategies would rezone 82% of the county's single-family homes, opening up neighborhoods to denser development, such as duplexes, triplexes, quads, multi-unit housing. Last week, I identified a number of problems with these strategies. If it were to pass, it would create more growth, which needs more infrastructure to accompany the growth. At least one planning board member and staff have said that the adequate public facilities ordinance would address the infrastructure problem. That's a nice concept, and it might have been true in 2007, but because what I outlined above, the standards and fees no longer adequate to provide adequately for our needs. And that's a problem. At the same time that the planning board is arguing for dense growth deep in single-family neighborhoods, they've also recommended growth in infrastructure policies that would cut the funding needed to support growth. I'll point out that the county has lots and lots of property development that's been zoned for in the county. And where it's been zoned, they've had to take into account street design, stormwater, and environmental impacts. There is none of that on attainable housing because they don't know where the housing is going to go. It's impossible to make plans for how you're going to deal with it. The Office of Management and Budget estimates that the Planning Board's recommendations for the GIP would reduce the county's revenue by about $28 million over the next 6 years. That is $28 million we won't have for transportation and schools. Let me give you an example. Imagine a neighborhood in Bethesda or in Silver Spring where the AHS has allowed developers to build 3 townhomes where there was once a single family home. I actually saw this actual example in Bethesda right off of Wisconsin Avenue. That's more families, more cars, more kids attending schools. This was only one structure, mind you, so it's not in itself is not a problem. But if that's the policy, and this is where it goes in neighborhoods, it will be a problem. If the infrastructure in that area isn't upgraded to handle the growth, if the roads remain the same size, if stormwater drains aren't expanded, and if local schools are already at capacity, then what happens? Traffic gets worse, flooding risks increase, and the children end up in overcrowded classrooms. This isn't just theory. It's what we've seen happen in parts of the county when the development isn't matched by infrastructure improvements. But here's the worst part. All of the growth that you're being told is coming here has already been planned for. The attainable housing that the planning board seeks is actually in its very own master plans. They've gone completely outside of the master plans. They don't tell you about the master plans. But the fact is, all this growth comes from projections based on master plans. They literally, on a regular basis, review their growth projections and tell the Council of Governments, which is what produces or compiles all this, they tell them what they expect to be built in housing and in commercial development in 5-year intervals over the next 30 years. And they do this based on the master plans. So the growth numbers are based on those estimates. And we plan for our expected growth. We planned in the past for growth. That's why you see, Germantown was a planned community. It's why you see the development that's happening, the new project in Wheaton, which is a very large project in Wheaton. It's why you see anything you see, any of the new buildings that came up in Bethesda are all products of the master plans that we have. And there's lots more in the master plans than what you see because you don't see it until it's built. The planned out growth has plenty of opportunities to build housing of all types inside of these plans. And if the Park and Planning doesn't think there's enough of what they call attainable housing, the easiest fix of all would be to go back and review the plans they've approved, and particularly with their obsession with high rises, and look at rezoning some of the areas that are further from transit and rezoning them for lower buildings, even townhouses, quads, duplexes, and all the things they want could be built far more affordably there than high-rise units are. If you want to make an area unaffordable, build a lot of high-rises right now, and you pretty much guarantee, you can look at the prices in Bethesda, they're affordable to very few people in our population, and let's say bluntly, the prices are far above the area median income if you look at Black and brown communities in the county. So those folks won't have opportunities to really move there. The disconnect between pushing dense growth and cutting the funding to support it doesn't add up. Infrastructure has to accompany development. It can't be an afterthought. It can't be something that you hope will eventually get done because people will immediately feel the impacts if anything is done at scale. I've said it before and I'm going to say it again. We can't afford to do harm to our infrastructure funding through this skip approval process. Passing this policy as proposed by the planning board would be harmful. We have to be able to fund the roads, schools, and transit systems that our growing population will need, and cutting $28 million in revenue without a clear plan to replace it would leave us without the means to do that. And this is where it really impacts the county budget and our future. Without implementation of the adequate public facilities ordinance, residents end up shouldering the entire cost. And we shoulder it in one of two ways, either by paying for the infrastructure, which means higher taxes inevitably, or by suffering the consequences of insufficient infrastructure, in which case you have overcrowded schools and more traffic. The planning board has proposed a work group to explore replacement revenue, but there's no specific about the work group meanwhile, and the revenues would decline. 4 years ago, a different county council cut the impact taxes on particular projects, especially impacting school funding. I vetoed the bill then because of the harm it was going to do to revenues. That council overrode the veto and later increased recordation taxes, which land on residents primarily, to compensate for the loss of revenue by cutting the developer's share. I don't think that anyone wants to do that again. I've long supported the idea of special taxing districts, similar to what Northern Virginia has successfully implemented, where developers and commercial property contribute their fair share to the infrastructure that supports their projects. We can't afford to cut funding now while hoping that a new system will be put in place sometime in the indefinite future. In Tyson's Corner, the county tax on commercial property is $1.51. In Montgomery County, it's $1.04. So apparently businesses are fleeing, as some of the advocates of this like to say, are fleeing to Virginia to pay higher taxes that are almost 50% higher than ours. Actually, they're leaving because the taxes in Virginia are taxes that the developers asked for, And that enabled Fairfax to be able to build the infrastructure they needed to support their businesses and the economy. Businesses recognize the value of well-spent infrastructure money. And in Virginia, they demonstrated they're perfectly willing to pay for it. And it's the same developers in Virginia that are here in Montgomery County. I hope we can seriously reconsider the planning board's recommendations. And we all want to see the county grow, but we need to make sure it grows in a sustainable and fair way. Let's ensure we don't underfund the infrastructure that supports our growth and the growth we're planning for to benefit all of our residents. In a good growth story, on Wednesday, I helped welcome MilliporeSigma to its new headquarters in Rockville near the University of Shady Grove. The building they opened is devoted to biosafety testing, which is critical stage in drug approval process. It is essential for developed drugs to be tested so they can pass safety benchmarks and make it to the marketplace. New facility costs $286 million, represents an $8 million investment in automation technologies, and it's absolutely beautiful. Through the years, I've met employers at this company who worked at different locations in Montgomery County when it was known as BioReliance. MilliporeSigma bought out BioReliance, which had more than 75-year history in the county, but nothing like this new state-of-the-art facility. This opening helps the company with 270 employees locally and expected to grow another 300 jobs over the next several years. Having all the employees in one location in the county is going to enable them to collaborate and innovate more easily while serving pharma clients here and around the world. Maryland's Department of Commerce Secretary Kevin Anderson joined us for the opening because of the state loan of $1 million through the Advantage Maryland program. The project also benefited from a $100,000 incentive package from our county's Economic Development Fund. This is a strong sign we not only have a robust biohealth industry in place, but that we continue to grow. We will continue to be the heart of the nation's #3 hub until we become the nation's #2 hub and hopefully #1 hub in life sciences. And we welcome expansions like this in Montgomery County. On our weekly health report, this week we saw another week of declining COVID cases in Montgomery County, but for the first time this season, flu cases are up in our emergency departments. That is a good reminder that throughout October and November, the county will offer free flu vaccination clinics for adults and children. The first two opportunities are Wednesday, October 16th and Wednesday, October 23rd at the Universities of Shady Grove building in Rockville. This is building #2, and the clinics will be from 2 to 6 p.m. Appointments are encouraged. And if you'd like to give my health, I'd like to give my health team an opportunity to provide any comments before we open it up to questions from the media. So, health team, anything you want to say?
Dr. Bridges, do you have anything you'd like to add?
Nothing this afternoon, Mr. O'Donnell. Absolutely. Well, I said nothing this afternoon, but absolutely please stay up to your vaccinations. I know you're going to say that, but we are into respiratory distress, illness season. So we need you to get your shots, your flu shots, your COVID updates, your RSV, if you're age appropriate. And remember those public health practices to wash your hands. We haven't gotten away from that. And I know a lot of folks aren't washing their hands consistently. Hand sanitizer is good, but nothing is more preventative than washing your hands for more than 20 seconds. So thank you, Mr. O'Donnell. I'll toss it back over to you for any additional comments and or updates.
I just wanted to add that we do expect to get some COVID vaccine in to the health department sometime this week, and that's specifically for those individuals who don't have insurance or whose insurance don't cover vaccinations. We just want to remind folks, we know that it's a little more complicated now. Sometimes with your insurance, you have to find out what pharmacy or what provider will take your insurance for that vaccination. But for those people who just do not have insurance at all, we'll have some COVID vaccine for you. And you can check our website, or you can call us at 240-777-1050. And we'll let you know where our clinics will be once we get that vaccine.
Thank you, Mr. O'Donnell and Dr. Bridgers. Members of the media, any questions right now for the county executive or the rest of the team? Please raise your hands. Gina Bixby, Mocha 360, good morning.
Good morning, Lorna. Hi, Mark.
Hey.
It's very clear you are not a fan of the attainable housing proposal. Could you speak a little bit to, you've spoken a lot about why you think it doesn't work. Could you speak a little bit to what your solution would be, what you see is kind of the best way to fix the problem we're having with affordable housing?
So, thank you for using the word affordable housing. And the reason I thank you is they don't use the word affordable housing. And I've been trying to tell people, because you're not the first media person who said, how do you fix their problem of affordable housing? On the front page of their document, we showed this 2 weeks ago, I think it was, maybe it was last week. We actually have, there's a little box and they ask themselves the question, is this about affordable housing? They say no. They use the word no. This is about market rate housing. So if you want to solve the affordable housing problem, this is not the thing that you do. All the evidence is that, and you can see it in Bethesda. We gave the example of the one townhouse, the three townhouses, I mean, where the owners sold their single family house for $1.6 million. The three townhouses cost $3.6 million each. This has nothing to do with affordable housing. They have no requirements for affordable housing. None of these developments would trigger the moderately priced dwelling unit law. Just how naked this is they allow 19-unit apartment buildings if you assemble enough property. Do you know why 19 is the magic number? I'll tell you, because there's no requirement for affordable housing units until you reach 20 units or more. They know exactly what they're doing. They're not trying to build affordable housing. They started talking about affordable housing in the very beginning, but when people realized that's not what they were doing, they just dropped the word affordable and they called it attainable. But it's not attainable to everybody, and it's not going to be attainable to everybody. If you go into a neighborhood of $1 million houses, or say $800,000 houses, whatever they build is going to be $800,000. And you can talk to any real estate agent, they'll tell you the same thing. If you're building in a neighborhood, you're building to market. You can look at the product from any number of developers where they build townhouses. Townhouses meet the market, and there's plenty of $1 million plus townhouses in neighborhoods, particularly in new developments now. So it has nothing to do with affordable housing. If you want to do something about affordable housing, which is what we've been trying to do, we require higher percentages of affordable units when we have leverage with the developer. So if we're making a deal, we try to make sure that we get more units than the standard 12.5 or 15%. We'd like to, and we were going to send something to the council where we actually codify higher percentages of required affordable housing. We're trying to achieve deeper affordability. Right now, the MPDU program, which is our real affordable housing program, focuses around incomes around 70% of area median income, 65 or 70%. So it leaves out lots and lots and lots and lots. Let's say tens of thousands of people who earn less than that. We occasionally get lower priced units, but we don't get them in quantity. And the program's not focused on quantity of the lower priced units. It's really focused on the moderately priced units. We really don't have a low priced affordable policy other than what we've been able to negotiate. What else can I tell you? There's a project I think you guys have reported on in Pike and Rose where a developer had an approval for 3 high rises and 2,000 units. And the developer came back and actually came to the county and offered to partner with us. And he's going to change the development from 3 high rises, which he says he does not have the market for, and is going to build lower rise buildings. And the county is supposed to get almost half of all the units he's going to build here. Unheard of amount of affordability across a range of incomes, and a really good policy. And the planning board's fighting him and wanting him to build the 3 high rises. And where he would get far less, where we would get far fewer affordable units. So even when they have the opportunity to do the right thing and the developer wants to do the right thing, the planning board's saying, no, we want you to build high rises that aren't affordable. It is, affordability is so far from the planning board's useful vocabulary at this point that it's really disturbing. And I'll tell you, if you look at places like Arlington, or you look at places like Minnesota that are held up on the one hand for doing some of this housing type, I can assure you, you're going to see a lot more emphasis in affordable housing than anything planning board does here. So just you're saying the word affordable, it just tells me what an excellent job they've done at misleading people into thinking this is about affordable housing, because it's really not. And if you want affordable housing, you've got to zone for it. You're not going to get it any other way. And you've got to require housing types that can be built affordably. That's why one of our suggestions is that we look at the opportunities to work with developers to buy some of these office parks that are going vacant and using them as ideal places to build townhouse communities that could be built affordably, or looking at some of the areas where they've overzoned for height around metro centers, the walk shed, which is the distance people will walk from residences to transportation, is about a half mile. Nobody recognizes more than a half mile. Well, Mata's walk shed around metro stations is a half mile. That's where they expect walkers to come from. And it's not as the crow flies, it's as you walk, which means it's even narrower than a half mile radius of a circle. Parkins Planning's radius is a mile. That's not a walk shed. That's not the walk shed anybody but Park and Planning recognizes as a walk shed, and has implications because you don't put density in an area where everybody's going to drive. That's why people focus, even Virginia, I hate to say that, even Virginia and Tyson's Corner, they focus the density in the first half mile around the metro station. They reduce the density after you get beyond the half mile. And reduced density in lower buildings results in prices that are more affordable. So Park and Planning's actions undermine anything they talk about in terms of affordability. And this policy has no affordability in it. Neither did Thrive, neither did the Tacoma Park Master Plan, where they actually wind up having fewer affordable units than are on the ground today. So I'm more than happy to sit down with you and show you all the data, show you their reports. But we're already zoned for all this growth. That's the other thing. They do. This report is, generated out of Council of Governments. And every few years, all of the planning agencies in the entire DC area, they make projections of the future growth of their respective counties. And they go through an analysis of all the little zones, they're called TAZ zones, in their counties. And they estimate how much of the planned growth will happen in 5-year intervals over 30 years. I can walk you through this. I can show it to you in their own projections. These are their projections. So this is what they've planned for. This is not a surprising new 10,000 or 25,000 people coming here. These are people who are planned to come here. We've planned the housing for them. And if there's too much high rise, which they can't afford, then we should be rezoning for what people can't afford. I'd do that in a heartbeat. But I really would love to sit down with you and some of the other reporters that we've been talking to, because almost all of you lead with, well, what is your strategy for affordable housing, if not this? And it's like, this is really not an affordable housing strategy. We have one. This is not a policy.
Thank you, Mr. County Executive. Any follow-up questions, Ginny?
No, we got a lot there. Thanks, Mark.
Thank you.
Ginny, I really would love to talk to you about this, though. I'm serious. I mean, because you're not the only person who said this, and I feel like there's a lot of misinformation out there, and we'd like to correct it so we can maybe arrive at a rational policy for dealing with the affordable housing problem.
Yep, sounds good. Yeah.
I see Judy Spruce from the Greater Olney News has her hand up. Good morning. Good morning still, Judy.
Yes, good morning. I went to another community meeting last night that the excuse me, the Greater Olney News or the Greater Olney Civic Association had about this topic, only about this topic. And the question is, in your estimation, Mark, why is everyone drinking the Kool-Aid? That
Well,
we need this housing.
because first of all, they were misled, and they were deliberately misled. The use of affordable, which they started wrapping this, and they did the same thing with Thrive. Everybody thought, oh man, we're going to be planning these complete communities, and then you unwrap the thing, and you don't get that. In Thrive, there was, the council paid for a racial equity analysis, and the person wasn't able to complete the analysis on the funding. But at the point he had to stop, when he asked for more funding, the council wouldn't give him more funding. But he said this policy has potential to be racist the way it's written right now. And that was the end of the discussion about it. We did an equity analysis on the Tacoma Park Master Plan because neither the council nor the planning board did one. And we found the same thing there. They're actually going to have fewer affordable units after the thing gets built than you had before the thing, if it gets built out the way it's planned. This is pretty disturbing, but they just keep using the word affordable. Now I would say now they've stopped using the word affordable and calling it attainable. But attainable home ownership, if it's going to match the prices in neighborhoods, which is what it will, is not really going to reach the people that a lot of parents are worried about their kid graduating college and getting a $60,000 job and not being able to find a place to live in Montgomery County on $60,000. That would allow you to pay about $1,500 a month in rent. And ownership would be not pretty feasible for you. Anyway, it's they've done a lot of misinformation. They got a little echo chamber of people who really, what they really want is growth of this type of housing. They don't want inclusive housing to grow in the county. You don't hear them talking about, and you don't see it in Thrive. You should go back and read that document and see what they talk about in terms of affordable housing and strategies to deal with it, because they don't have any strategies to deal with it. But people just, people drank the Kool-Aid because you started out talking about affordable. If they'd gone out there and said, we just want to build more high-end market housing in the county, I'm not sure people would have been terribly excited about that. But affordability does hit people's social conscience. And, we've been trying to push higher levels of affordability. We certainly do it in the projects that we try to put together. When we make, like I said, if it's a project, like one we controlled completely is a project on Randolph Road and Veers Mill Road, where 100% of 200 units are going to wind up in the 30 to 80% range of affordability. But that's a case where we had a lot of control over the land because of the county. In places where we're working with developers and they need approvals, or we had to contribute, we contributed a parking lot to the development that becomes part of the development, we still are able to get higher percentages of affordability than the minimums. But you only get affordability when you push it and you have regulations that either require it, or you have the ability to provide incentives so you can get a decent amount of affordable housing. But this has nothing to do with affordable housing. It's not in there. Read it.
Right. Thank you.
Thank you, Judy. Members of the media, any other questions for the county executive or county officials this morning? Any other questions? No more questions? Well, thank you for joining us. Have a great rest of your day, and we'll see you next time. Thank you, Mr. County Executive.
Thank you.
Mhm.